Assess cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens, by testing smooth pursuits across full horizontal and vertical eye movements. Ask your patient to follow the pen with their eyes without moving their heads. First, test motion in the horizontal plane. You will know that full motion is achieved when you can no longer see white space in the lateral or the medial portion of the eye. Next, assess vertical motion, bringing the pen level to your patient's forehead and their chin. Your pen will make the motion of an H. Assess for motion in all direction and nystagmus. If both eyes are limited in the same direction, this is called a gaze palsy and is indicative of a central or an upper motor neuron lesion. A disconjugate gaze occurs when one eye is limited or both eyes are limited in different directions. This indicates a lower motor neuron lesion or a problem at the neuromuscular junction. The trochlear nerve innervates the superior oblique muscle. A trochlear palsy can cause weakness with downward or torsional movement of the eye. When weakness in the downward movement of the eye is present, the affected eye will drift up at rest as compared to the unaffected eye, and your patient will complain of double vision with downward smooth pursuits. Your patient may present at rest with their chin tucked, as this position will help move the eyes back together. A trochlear nerve palsy will also affect torsion of the eye, which is the normal response to tilting of the head sideways. With torsion, the eyes automatically rotate in an equal and opposite direction so that the environment is unchanged with movement. Patients with a trochlear nerve palsy tilt their heads to the opposite side to compensate for the torsional palsy. The characteristic appearance of patients with fourth nerve palsies is their head tilted to one side and their chin tucked in. Cranial nerve 6, abducens, innervates the lateral rectus muscle. A cranial nerve 6 palsy will result in lack of complete lateral eye movement, and at rest, the eye will cross inward towards the nose. This inward position of the eye is called estropia.